Good afternoon, everyone, and thank you so much for joining us today. My name is Mai-Ly Duong. I am an associate professor at ATSU University, and I'm the associate director for our special needs clinic at ATSU University's Arizona School of Dentistry and Oral Health. Today, we'll be talking a little bit about self-advocacy and self-determination at the dental office. In other words, we're going to be talking about some tools that you can use to help advocate for yourself and help make decisions for yourself while you're at the dental office. This webinar is being supported by a grant that was awarded to ATSU University from the Arizona Developmental Disabilities Planning Council. So what is self-advocacy? Self-advocacy is recognized as the ability to speak and act on behalf of oneself or yourself or a cause. It is a very important skill that individuals with disabilities use in order to live their life and to navigate through life. Some of the skills that demonstrate when you have self-advocacy is being assertive about your rights, about what you want. It's also having the ability to ask questions and stand up for yourself. Self-determination is the process of taking control and making decisions that affect one's life or affect your life. It provides you with the skills and the abilities to support yourself, to make decisions and choices for yourself, to solve problems. It also means that you can make goals and achieve those goals. And it also allows you to independently identify and determine when you need help and be able to ask for that help when you need it. So in the dental office, it's very important that patients, especially individuals with disabilities, develop skills where they can advocate for themselves as well as provide self-determination, which means that not only can they advocate or support or defend themselves, but it also means that they can make decisions for themselves. And so it goes hand in hand. By being able to understand what's going on, to ask questions, to make decisions means that they're able to advocate or support or defend themselves and what they feel is appropriate for their needs, their health care, and themselves. And so when we talk about advocacy and determination in the dental office, it's very important that individuals understand that they have a right to achieve and obtain and receive good oral health care, and in addition to good overall health. And so that requires a continuous exchange between the patient or the individual with disabilities and their healthcare provider or their oral healthcare provider. It also means that they have the right to be informed as well. So part of that discussion or that conversation between the individual with disabilities and the healthcare provider is that they're being informed properly about the conditions, the issues that are happening in their oral health, and they're also informed of their options and the pros and cons, the advantages or disadvantages, the benefits and risks, as well as alternatives to those treatment options. That way that they are able to make good informed decisions, because that is a right that they have and deserve. So in the next few minutes, we're going to talk a little bit about some strategies that individuals with disabilities can implement or use in order to help establish and start the process of learning and developing some of these skills that can help them self-advocate and self-determine while they're at the dental office. And specifically, we'll be going over 2 worksheets that can be downloaded from the internet and utilized at every dental visit if desired. The first worksheet that we'll be talking about is called a positive personal profile. The first tool that we'll be talking about is called a positive personal profile worksheet. Now, this worksheet is a series of questions, and it can be used as a tool that helps you better understand who you are, what your likes and dislikes are. But in addition, when you share this worksheet with your healthcare providers, they know you better. And the better you are understood and the better that your providers understand who you are, the better your relationship will be. And a patient-doctor relationship is very, very important. And so the more you get to know each other, the better you can build trust, and the better your doctors can help you achieve good healthcare. And the best way to use this worksheet is to answer the questions before the appointment, bring that worksheet with you, and share that worksheet with your provider. This is what the worksheet looks like. And as you can see, it's a very simple worksheet. It's one page and has 6 questions. Now, these questions can be used at multiple visits, and you can always bring it with you to every dental visit. But if you start to find that there are additional things that you want to add as you go through, and you find that you like certain things or you don't like certain things, you can add it to this worksheet, and then just bring this worksheet with you every time you go see a healthcare provider. So the first question is, what do you like to do with your friends and family? So this could be, you like to go to the movies, you like to play tennis, you like to go hiking, you like to go fishing. So these are things that you like to do with your friends and your family, and it allows you to share with your providers a little bit about the things that you do outside of the medical office or the dental office. What is your favorite food is the second question. Now, we all love to eat. And so it's a great place to start when you're getting to know someone. And so it might be that your favorite food is spaghetti, or it might be that your favorite food is chocolate ice cream. So it's really important that your providers know this, because it's a great conversation starter, but also sometimes different foods can affect your oral health or your mouth and your teeth. And so if we know what kind of food you like to eat, it helps us better understand how we can help you maintain good teeth and good gums. What was the last movie you saw? So this is, again, another great way for your doctor to get to know you, because maybe you guys might have a favorite movie, or you guys might share the same last movie that you saw. The fourth question is, what do you like best about yourself? So hopefully you can share a few things that you love about yourself. Maybe you love that you are good at basketball, or maybe you love that you are really good at math. So write down what you like most about yourself or best about yourself. What do your friends, family, and teachers like best about you? Maybe your friends and your teachers love that you are so nice, or that you love to smile, or that you love to laugh, or that you are very good at making others laugh. So find out what other people like about you, and you can write that down. The last question is, what things do you need help with? So this could be that you need help opening water bottles, or it might be that you need help writing things down, or you might need help remembering certain things. So the more we as providers and doctors know about the things you need help with, the better we can help you. So again, this is a simple tool that you can fill out before you go to each dental appointment. And once you fill it out, bring it with you to your dental appointment and share it with your doctors, your hygienist, the assistants in the dental office. And it allows you to have different things you can talk about, but it also helps our dental team get to know you better. A second tool that you can use is called the My Dental Appointment Worksheet. Now, this tool has a series of questions that help you and help us as dental providers better understand the issues and questions that you have about your mouth, your teeth, and your gums. And when you can use this worksheet effectively, you can communicate better with your doctors, and that means they can help you better. And the way you use this worksheet is by answering the questions beforehand and then bringing the worksheets with you to the dental visit. So the My Dental Appointment Worksheet is actually 2 pages, and this is the first page. It's very important that you put your name and the date at the top. And it's also very important to identify who is the best person for us to contact if there's ever an emergency. So make sure you put their name and their phone number up at the top. This worksheet also reminds you to bring your insurance card and or any money or whatever means you have to pay for your dental visit. And then you'll want to make sure that you write down your current medical conditions, your diagnoses, as well as any medications you're taking. And then at the bottom, it asks you whether or not the upcoming dental appointment is for a checkup and cleaning, or if it's because you need something in your mouth fixed. And this helps us as dentists or doctors and hygienists know what you expect to take place at the dental visit. The last question on this first page asks you if anything bothers you in your mouth. So if a tooth hurts, or if your gums are swollen, or if you find that you're bleeding in certain areas of your mouth, or if you have a question about something that is bothering you in your mouth, make sure you write it down here. This is the second page of the My Dental Appointment worksheet. At the top, it'll ask you, if you did write down what bothers you in your mouth, does it bother you all the time or just sometimes? Does it bother you when you're eating? Does it bother you when you're just sitting there watching TV? You'll want to write down when it bothers you, where it bothers you, and how often it bothers you. If it bothers you all the time, make sure you write that down too. The next question is whether or not it hurts when you brush your teeth. How many times a day do you brush your teeth or floss your teeth? And then it'll ask you if you have any questions for the dentist or the doctor. The second half of the page, you can fill out after you visit the dentist. Well, that's it for now. If you have any questions, please feel free to get a hold of us. Have a great day.